Celebrating our 40th anniversary is in so many ways about celebrating the individuals and the organizations that we've worked with over the years to try to understand as well as possible the needs of the farm workers, the needs of the health centers that serve them, and how we can make a difference in the lives of those individuals. People who get involved in migrant health tend to be involved in migrant health for life. It becomes a true calling. And that doesn't happen with everybody. And so the question is, how do we open the doors to everyone who touches the lives of farm workers and make it possible for them to see them for the human beings that they are? The National Center for Farmworker Health has been effective at creating tools and putting them in the hands of the staff of health centers that need to use them, because we find that the things that have been developed are usually of a literacy level that's way too high, and they don't present images that our farm worker patients can identify with. So I think that NCFH has done a good job of preparing tools to help patients to manage their own care. And the fact that these are not third-generation welfare families, but people that are willing to work very, very hard just to put food on the table. So as we open doors and open eyes of staff of health centers and of affiliated organizations, we build champions for migrant health. We really need to think both about food production and where that's going, and the culture of our residents, and the changing ethnicity of the people of this country, and be prepared to be more welcoming of diversity all around us. And in the 20th century, one of the biggest things that happened was the Bracero program, was the fact that we needed to have farm workers on the farms to replace our farm boys that went to the European War Theater. So we created the Bracero Act. We have a tendency now to blame farm workers for being here, to think of them as interlopers and outsiders. But why would we be surprised if for a period from the 1940s until the 1960s we had farm workers coming from Mexico on a regular basis? Why would we be surprised even after we close the doors that they keep coming? Because their families are here. They've been established here over many, many years and generations. So it's important for us as Americans to realize that we are stronger and healthier when we are accepting and when we welcome and find a place in society for those who come to live here and work here. We haven't solved all the problems of farm labor. We haven't cured all of the farm workers of all of the things that ail them. But what we have done is to touch individual lives of those who put food on our table. So whether we do that in the health center when they come in to improve their health status, whether we do that in the field as we support their ergonomic well-being, whether we do it in their home when they open their doors to us to come in and allow us to help them with health education messages that they can take with them wherever they go. The people that touch the lives of farm workers both directly and those who touch the lives of farm workers indirectly are essential to this journey that we've been on.